They start entering on in the computers. In Max, we have got cow. Cow is computer on wheel.
Wow, such a good abbreviation, cow.
So she goes to the patient room carrying the cow. Fusion. And I'm associated with this for last, say, about 13-14 years. And I'm the president for it. In fact, we are hosting the annual conference tomorrow in Hyderabad as I speak.
Wow. Hello everyone and welcome to Medgate Today TV Digital Present Healthy Talk Show, where we elevate your journey to optimal health through expert insights and empowering stories. Today we have a very special guest with us, Colonel Binu Sharma, Senior Director of Nursing at MEX Healthcare and President of the Indian Nursing Society INS. As a visionary leader, Colonel Sharma embodies the heart of healthcare, driving innovation and excellence within the nursing fraternity. Her dedication has made a lasting impact on healthcare in India, and now through her presence and perspective, she brings her global perspective to us and our global US affiliate. Please join me in welcoming Colonel Binu Sharma. Hello ma'am, it's our honor to have you on the board and very nice to meet you.
Thank you, Ritika. Thank you for having me here, first of all, right in the morning. And it's a pleasure to be here.
Thank you so much, ma'am, for your good words. So, starting with the interview, could you please tell us about yourself and your journey in the healthcare, as you have completed so many decades in the healthcare? And in addition to this, what inspired you to be in the nursing fraternity, as the nursing fraternity is the core of healthcare?
Very interesting to start with. I would say honestly, I have no background of the services in my family, no background of the healthcare. I have a very, very humble background. I was born and brought up in a village in Delhi, Mahipalpur. I'm not sure if you've heard of that village. And I studied in a government school. The village had just a primary school. But I was very ambitious. I think right from the childhood, I had very big dreams. So I wanted to do something very big. I remember some people asking me when I was just a few years old, what do you want to become? And my answer was the Prime Minister of the country. I didn't know what does a Prime Minister do. So I was ambitious, and I had no idea I would venture into healthcare, and that too in this specialized field of nursing. I was a science student over time, and I thought, okay, I would probably take up medicine. Those days, medicine and engineering were only the two prestigious fields which were normally spoken about. So I thought, okay, I will study science, I will take up medicine, and I started preparing for it. Ultimately, as time would have it, I did not join any of that. I ended up joining statistics honors in Delhi University because I was very bright in mathematics and I was a very high scorer. So I started on my journey of stats honors at Venkateswarai College.
Wow.
And I was a topper there in my starting of the career. Although I was there, my mind was there. Somehow my heart was not there.
Exactly.
I am a very people's person. I want to be with people. I want to do things for people. I want to talk to people. I'm a good communicator. So my heart was not there. One of the days I just noticed an advertisement for military nursing services entry.
Okay.
And that kind of got my attention. I had no idea there are nurses in the military hospitals. So I just noted down the address, because those days we didn't have a mobile, we didn't have cameras. So I ended up visiting Delhi Cant to understand what it is, and I applied. And the next thing I know, I gave my written test, I gave the interviews, and I got into the merit list, and I got an offer to start my cadet officer's journey from Indian Navy, from Mumbai.
Oh my goodness,
and
totally different.
Totally different. Since I said I'm from a village and from the Brahmin community, they just were totally against it. They said, what? Mumbai? Why you want to go to Mumbai? You are a girl and you don't want to be a teacher. And why nursing? What is nursing?
I was about to ask how your family supported you.
So, at that time, my family and the entire community of the village was against it.
Oh my.
Honestly, I'm a strong person and I stand for my battles. I normally end up winning my battles. So I convinced my dad and I joined nursing as a cadet officer way back in 1977. And I have not looked back. I was told that come back if you don't like it. I never made a comeback. For last 44 years, I have been in this lovely, wonderful, unique, sacrificing, and the noblest of the noble profession.
Exactly.
And that's how I ended up becoming a nurse in the military nursing services to start with. After about 22 years of service, I decided to still take up another adventurous journey of healthcare, which is in the corporate world, the private sector. And I took a premature retirement and I joined Max Healthcare way back that time, soon after my retirement the next day. And that was a totally different experience. I'm also so proud that I belong to nursing. I belong to the Indian healthcare system.
Exactly.
Which is advancing by the day, which is making so many advancements in the country, and where I am personally able to make a difference.
Exactly.
That's what is my starting journey, Ratika.
And healthcare is the key which serves the nation very from the root, because when you are healthy you will do the best out of yourself. And if I say about your life, it's like a roller coaster, because a topper from mathematics is just jumping into healthcare, which is biology.
Absolutely.
In schools, we say that if you are not good in mathematics, just go for biology. But look at you, you are the live example of being a topper in maths and jump into a biology. You inspire a lot of new aspirants who are serving and who are thinking to become a person who can serve in the healthcare. It's very nice to know this, ma'am.
Thank you.
So,
Thank you.
Starting with the second question. Ma'am, how things are going with the patient care and patient safety?
Okay. See, patients come to hospital for their treatment.
Yeah.
The first and foremost goal and rule of safe care is first to do no harm. That is the definition of safety. So if that is the motto to be followed for safe healthcare, for safe nursing, and nursing being the heart of healthcare, being the backbone of the hospitals, because patient care is completely dependent upon the nurses.
Exactly. They are on the hand of nurse.
They are right at the bedside.
True.
And they spend 24 hours at the bedside. They make the difference. They carry out the care recommended by the doctors. They are partners in care with the doctors. So, if patient safety has to be practiced in the hospital, nurses who are nearly 60% of the manpower of the hospital, they have to practice it in toto 100%. Whether it is preventing falls in the hospital, whether it is preventing pressure injuries in the hospital, whether it is ensuring safe medication practice in the hospital, preventing patients from acquiring hospital-acquired infections, surgical safety. These are all aspects of safe care, and carrying out accuracy and timeliness of the treatment are aspects of healthcare, aspects of nursing and healthcare. So I, along with all our fraternity of nurses, in the hospitals, I take care of multiple hospitals, a chain of hospitals.
Wow.
We have a critical focus on safe care, accuracy of care,
Very nice.
timeliness of care, and appropriateness of care.
Wow.
Because patients need different care in different settings.
Exactly.
Patients are in the outpatient, they are in the procedure rooms, they are in the operating theatre, they are in the cath lab, they are in a ICU, they are in a labor room, so they are in different settings. For different settings, you need different type of care.
Exactly.
Specialized nurses, they have to be trained that way. They have to be monitored, supervised, hence appropriateness of care.
If you allow me, I would like to say one more thing. Before meeting the doctor, the patient meets the nurse first.
Yes.
And the nurse always comfort the patient first. And after that, the doctor comes and do the treatment. And nurse fraternity is the one which deals with the, as you said, with the patient 24/7.
I would add a line here which I always remember as a nurse. A nurse is the one who opens the eyes of the newborn.
Exactly.
And a nurse is the one who closes the eyes of the patient when he dies in the hospital.
Exactly.
That is the
slide
dynamics.
gives me goosebumps.
That is the dynamics of nursing. Despite all the stress, the grievances in the hospital, the grief in the hospital, the family members crying because of acute illnesses, the nurse is the one who stays calm, composed, always smiling and comforting and reassuring everybody, not just the patient, but the family members, but everybody around in that framework of healthcare.
Yes.
That is the uniqueness of the nurse.
Let me ask one question adding to this. What are the challenges this workforce is facing?
Okay, a lot of challenges. See, nursing profession itself is very challenging. It's full of hardships.
Yes.
Because the job of a nurse is 24 hours. It's all the time changing. You have a life-threatening emergency, you got a baby getting born, you got road traffic accident, a gunshot wound. They have to switch various hats at all times,
yes,
right from emergency room to an intensive care unit. So I think a nurse has different roles to play all the time. And for them to be ready for it, you need to be a superhero or superhuman being.
Exactly.
And on top, in nursing, at least 70 to 75% nurses are women.
I was about to say this, ma'am. Literally, I was about to say this.
So, they are women, and you imagine you yourself are a lady, and once you get married, you have children, you got family,
yes,
you got dual responsibility, you got a challenging job in the hospital, and you have work-life balance challenges at your family.
Yeah.
But in the life of nursing, although it's a profession which is very demanding, which is very challenging, there are some very typical challenges.
Mm-hmm.
One is definitely being a lady, work-life balance,
mm-hmm,
long hours, working on
very
Sundays, night duties, 12 hours, 14 hours. Our country is a big country, and
it's a growing country.
It's
also.
a growing country, and the healthcare is also growing.
Yeah.
We have new hospitals coming up in the private sector. We've got hospitals in the government sector.
Yes.
All kind of hospitals. You need more and more manpower.
Very.
We are always falling short of the right numbers, the right nurse-patient ratios.
Yes.
You fill the numbers today, and tomorrow your patient numbers are high,
yeah,
or your nurses are moving on to other countries. You know, the attrition problem in our country. In fact, across the world, there are shortages of nursing.
Nurses, yes.
But it's a loss. We struggle to fill the gaps, especially in specialized nurses.
Yeah, true. Well said, ma'am. Well
so
said.
That's another challenge, having the right numbers in right specialities available,
yes,
skill mix, skill set, experienced nurses. Also, I would say in the private healthcare, nurses are not as well compensated as they should be. Although in the government sector, they are very well paid. In the private sector, when they start their career, they are not very, very adequately paid, I would say. That needs to change. Their working conditions need to change.
Yes.
The dignity of the profession in our country, they would come into the profession by need, not by
yes,
choice, because there is a job security there. So by need they would come. It was not a choice. People wanted to become doctors, engineers, they want to do BBA, they want to go into finance nowadays.
Yes.
But nursing used to be somewhere at the end of the choice.
Yes, it
When
wasn't at the first choice of any
It's not the
person.
first choice.
Yeah, got it.
Even now, it is not the first choice.
Maybe the third one?
Maybe the third, maybe the fourth.
But not the first one. That's
Yeah.
what you want to change.
So, what is changing gradually now, thanks to COVID, I would say, thanks to our country's political leadership, thanks to our Honorable Prime Minister Modi ji, during the time of COVID, the entire country realized the contribution of nursing.
Yes,